Alright, here we are in ATI's Fundamentals, edition 9.0. Chapter 1 is Healthcare Delivery Systems. These include communication between and function of all the parts of healthcare that contribute toward patient care. Who are the participants? We have clients or patients, providers and unlicensed personnel. Let's make the distinction. Providers are licensed, like registered nurses, licensed vocational nurses, advanced practice nurses, and medical doctors. Unlicensed are those greatly appreciated assistive personnel. What are the regulatory agencies? U.S. Department of Health and Human Services, FDA, state licensing boards, and the Joint Commission are examples. So we're talking about the big players here. How does healthcare get paid for? Okay, so we can't all pay out of pocket. I certainly can't. What do we have available? Medicare is for clients over 65. We have A, B, C, D. A is for hospitals, B is for medical, C is an Advantage plan, and D is for medications. Medicaid is for very low income. It's federally and state funded. The Affordable Care Act of 2010, also known as Obamacare, thank you Barack Obama, is meant to increase access and decrease costs. It is what it says it is. Finally, the state children's health insurance program is for kiddos up to 19 at a low cost. Private plans. We all would love a PPO, wouldn't we? Preferred Provider Organizations. You pick your doc from a list. It's an insurance plan. The levels of health care include the following: prevention, primary health care or screenings, secondary health care or the ER, tertiary health care, intensive care or technical care, restorative and continuing health care. What about safety and quality? What are the 6 QSIN competencies? Quality and safety education for nurses. Okay. First, safety equals minimizing risks. Patient-centered care is to be compassionate and include the patient in the decisions. Evidence-based practice. What does research say, y'all? Informatics. Use technology correctly. Quality improvement and teamwork and collaboration wrap it up. It's all about the population's welfare. Moving right along.